So when you are injecting this, you need omnipic. This is to confirm the position of your needle that you are into the joint. This is some local anesthetic that we are going to give on top of the skin so that the procedure is not too painful for the patient. This is a mixture of, this is around 4 ml. You can make it slightly more, but subtalar joint is usually tight, so it doesn't take more than 3-4 ml. So it is a combination of 80 milligram of depomedrone, which is 2 ml, and then you have got 2 ml of plain lignocaine. We have taken 2% on this occasion. So these are the things that you will need. So next step will be to localize the subtalar joint using fluoroscopy. So what I have done is I use a needle to localize the subtalar joint or the sinus tarsi. So I have kept this needle in this position, and I will show you the fluoroscopic images that where you should be and what is the right spot. So if you look at this x-ray, it does tell you that this lady has got a old calcaneal fracture. And this is the posterior facet of the calcaneum, and this is where you draw the angle of Gissane. So this is the spot that I aim for. So if you see, the needle is just about in the right space, and once my needle is in this position, the next step will be to just make it vertical and then go inside and insert some omnipaque. So after identifying the position, I have used a marking pen, and then I will infiltrate some local so that when you are putting your needle in, it becomes as less painful to the patient as possible. So once you have identified the spot, when you are starting up, it might take some time for you to negotiate into the subtalar joint. But when you negotiate into the right place, you will feel a giveaway sign when you will be entering into the subtalar joint. And I had that feeling. Now my next step will be to inject some omnipaque to confirm that I am in the right spot. So just a little bit of omnipaque, and then we will take some x-rays. So I think it is always advisable to use omnipaque, because and take these images, save it, put it in the patient notes, especially in this era where everything has become medical legal. So if you see this nice flow in the front and nice flow in the back, that confirms the position of the needle in the subtalar joint. And now it's only matter of injecting your steroid and local anesthetic into the joint. So I'm just going to inject the local anesthetic and some steroid into the joint. You will find some resistance, but it should go reasonably easily. And that's how you inject a subtalar joint. Once you inject the steroid into the subtalar joint, what it will do is it will wash away your omnipaque from the joint, and that line that was seen before will disappear. And that is also an indication, indirect indication, that you have injected the right joint, because if your needle moves, then the dye is not going to get washed off. So this is another confirmation that you have injected the subtalar joint correctly, because now the line that was seen before is disappeared. And I also save this image and then put it into the patient notes. So that is how you injected a subtalar joint safely.